In this video, the situation whereby a red fox, vulpes vulpes, is involved in a road traffic accident will be explored in terms of the risks of attempting to capture an injured wild animal, restraining techniques when handling a wild animal, triage of a wild animal, veterinary procedures, and the safe release of a wild animal. In line with the Royal College of Veterinary Surgeons Code of Conduct, all vets in the UK are required to offer emergency care for British wildlife. This implies that if a fox becomes hurt, you may take it to your local veterinary surgeon who will be able to administer emergency care. Red foxes are a naturally nocturnal elusive species of canine which start out life as social animals living in small packs consisting of family members until the age of around 6 months old, where they will venture out from the den and find their own source of food. It is at this time when red foxes are most likely to be involved in a road traffic accident, as they are not familiar with the topography of their surroundings and cannot determine risk as well as adults. Red foxes can live up to 9 years in the wild, but the lifespan of an urbanised fox is around 12 months old, and this is mostly due to the frequency in which foxes are involved in road traffic accidents. Red foxes are omnivorous opportunist hunters, which means their home range can be large and their diet can consist of many different food sources, including small mammals, birds, invertebrates, fruit, human garbage, and carrion. Urbanisation of red fox habitat has increasingly brought the animals under threat from more anthropogenic factors than ever before, and coupled with their omnivorous diet means there are many opportunities in urban environments for foxes to find calories, and equal opportunities for foxes to encounter hazards. Unlike most other wildlife species in the United Kingdom, foxes do not receive protection under the Dangerous Wild Animal Act 1976, so a licence is not required to possess one, meaning that pet foxes are at an all-time high, bringing these animals into the urban environment via other routes. Firstly, only people who have been vaccinated for tetanus should attempt to handle a wild fox, as zoonoses are common. Imperative to the success of triaging a fox that has been involved in a road traffic accident is gathering information on the animal's condition and behaviours by the finder of the animal. Whether the animal was exhibiting any ataxia, weaknesses, or lameness when found is important for further examinations and prognosis by a veterinarian. Exactly where the animal was found is especially important, as this information is crucial for the release of the animal after a successful first aid is applied. As foxes are wild animals who are naturally avoidant of humans, the interaction during the capture stage of fox rescues will cause stress for the fox, and increased heart rates are common. This increased heart rate should be taken into consideration when assessing the patient. Although the welfare of the animal is of utmost importance, the likelihood of the animal being released after surgery or rehabilitation should be the main concern of any rescuer. The preliminary triage should focus on the animal's ability to re-immerse itself into its natural habitat. If the injuries are too severe or the animal will be debilitated too much by any potential surgery, then euthanasia is advised, under the grounds it is more ethical to do that than release the animal to a slow and certain death in the wild. In the case of cubs, releasing them where they were found is the biggest factor in terms of success of any rehabilitation. If a cub is not released exactly where it was found, it will likely die. Captive release programs in Britain have been employed for decades, but there's not much data on the success of these programs and if they are employed correctly or efficiently. In one study, 251 fox cubs that were captive reared had tags inserted in them for examinations on their release effectiveness. Only 90 out of the 251 foxes survived, with many of them being involved in road traffic accidents as being the main casualties. The released foxes weigh significantly less than wild counterparts of the same age, showing that the stress of the capture had a deleterious effect on the welfare of the animals, even if at first the release seemed successful. Foxes are known to serve as carriers of sarcoptic mange and leptospirosis, which are both potentially zoonotic. As zoonoses have the possibility of propagating with wild foxes, appropriate personal protective equipment, PPE, is necessary when handling these injured animals. Foxes are known to bite when injured or feel threatened, so thick gloves and arm covering should be worn. A towel can be used as a last resort if there are no gloves to hand. Scuffing the fox is where the handler grasps the loose skin at the rear of the neck and is deemed the best way to restrain the animal for movement or examination, but can only be done to an animal that has not got head or neck injuries. Catch bowls or dog graspers can be used to capture foxes, and may also be used as a method for restraining the fox, but must only be done by someone with extensive experience with a catchpole. Two people are recommended for the catchpole method, as one is needed to attach a noose around the fox's neck, and another to manoeuvre the fox into the secure box safely. Catchpoles, however, can cause more injury to the fox if administered incorrectly, and a struggling, injured animal may hurt itself by trying to escape and only exacerbate the situation. Through the clinical examination process, a standard dog muzzle may be used to ensure no biting occurs. In the case of severe debilitation, foxes will be easy to handle, but caution is still advised, with sedation also advised to calm the patient and decrease the chance of any outburst. Sedation can be accomplished by administering 1 mg per kilogram of diazepam, either intravenously or intramuscularly, with intramuscularly being the safest option as it does not require the patient to remain entirely still. Once a fox is safely restrained, either through physical means or with the help of sedatives, a crush cage may be used to keep the fox restrained, as an internal movable panel that can be pulled to one side of the cage is employed to ensure the animal cannot move, ensuring it cannot cause harm to itself. There has, however, been controversy on restraining techniques, such as dog catchers and crush cages, as they are deemed to induce negative reactions and fear in patients. With the veterinary field moving towards a more fear-free ethos, equipment such as the dog catcher and crush cage are seemingly redundant ethically, but there have not been enough updates to the technology used to avoid the use of dog catchers and crush cages. There are no substantial clinical guidelines for vulpine cases in terms of handling examinations, so anecdotal experience are usually referred to when seeking advice on handling an injured fox. As there has only recently been an upsurge in vulpine cases and the empirical and practical research has not caught up yet, this poses an ethical problem for the more specific vulpine needs, as canines are used for a model for vulpine trauma cases. Canines do have similarities to foxes, as they are both part of the family Canidae, but they are not the same species. They have many differences in physiology, microbiology, and toxicological responses. An increase in research and funding is needed for understanding vulpine-specific veterinary needs, as the urbanization of foxes is going to increase at the same rate as the anthropogenic risks to the foxes increase due to habitat loss. When any potential rescues are called out to a collapsed, wounded, or injured fox, shock should be expected in some form in the animal. In road traffic accidents with foxes, the most common type of shock is hypovolemic shock. Pale mucous membranes, shivering, chilly skin, rapid or shallow breathing, rapid or weak pulse, pupil dilation, apathy, and lethargy are all signs that the animal is in shock. When shock is detected, the first step is to use the Dr. ABC method, which stands for danger, response, airway, breathing, and circulation. When you encounter a victim of a first aider, you must perform the basic DRABC process, and then this commonly referred to as a primary survey. The fox must be maintained quietly and, if possible, in a horizontal position to ensure proper circulation. Keeping the fox comfortable and dry at all times is imperative, and to conserve body heat, cover with light blankets or a jacket. A hot water bottle can be utilised, but be careful not to overheat the animal's body. The most frequent forms of trauma in wild foxes are road traffic accidents, entanglements, and attacks involving a dog, with road traffic accidents being the most prevalent cause of trauma. Typically, blunt force trauma causes diaphragmatic rupture and/or injury to the intrathoracic organs. Rib fractures are prevalent, and Royal Veterinary Nurses should be aware of the increased risks of the intrathoracic organs injury as a result. Urban foxes often can handle short-term housing in a veterinary clinic or rehabilitation facility, but long-term captivity has a deleterious effect on the animal's psychological and physical state, and its chances for a successful release, so extended housing of a fox should be avoided if possible. Thorough physical examinations are necessary when assessing the condition of a fox that has been involved in a road traffic accident. In the veterinary clinic, weighing the fox and evaluating the extent of any lesions, fractures, contusions, or hemorrhaging is vital in early examinations, as the earlier these examinations can be undertaken, the more chance the animal has of surviving. It is important to understand that foxes weigh different amounts at different parts of the year, and vixens that are raising cubs are more likely to be lean. Understanding the weight variations of a fox is an important aspect of a successful prognosis. Heart rate, respiration rate, and temperature also need determining early on in vulpine examinations. The resting heart rate of a fox being 75 to 185 beats per minute, and the average rectal temperature being 38 to 39 degrees centigrade, and respiration rate being 11 to 20 chest contractions per minute. Blood samples should be collected from the fox and is best accomplished via the jugular or cephalic veins. The blood collection can be done on a conscious animal that is well restrained, but for a particularly aggressive animal, blood is more safely required when anaesthetised. It is recommended that 0.07 milligrams per kilogram of metamidodine in conjunction with 0.8 milligrams per kilogram of midazolam or 2 milligrams per kilogram of ketamine is used for the anaesthetic process of free-roaming red foxes. It is recommended to monitor body temperature with the aid of a rectal thermometer and oxygenation when immobilized, with oxygenation levels being monitored with a pulse oximeter. Regular heart rate checks and respiratory checks should also be done throughout the anaesthetic process to ensure complications are not arising. Radiography can be employed to examine more thoroughly the extent of any fractures the fox may have had, and also aid in triage, and this will also mean the veterinary team can assess the potential of the animal being released. There are 3 methods of radiography currently used in veterinary clinics, which are film screen radiography, computed radiography, and direct digital radiography. Although film screen radiography is more commonly employed, CR and DR have more advantages as they are more portable, cost-effective, emit less radiation, can be manipulated by software. In the case of DR, the image can be sent directly to a computer system for instant transmission. In extreme cases of injury, ultrasonography can be used, but caution must be given on shaving too much hair off the fox, as this can severely impact thermoregulation, particularly in the latter colder months. An effective way of assessing the amount of endoparasites a fox may be carrying is by using fecal parasitology, which assesses through fecal matter the density of endoparasites in the animal's digestive system. Another simple test that can be carried out is skin scraping, which can be used to develop a prognosis for sarcopic mange and other skin conditions. Vixens are commonly misdiagnosed with hair loss due to mange, but it should be noted that female foxes lose hair while lactating, so this should be considered and not be confused in diagnostics. Nutrition levels and dehydration must be examined closely when a fox is entered into a veterinary clinic, as this animal may have been debilitated for a large amount of time. Adult foxes will eat tinned dog food, while cubs will drink canine puppy milk, so this should be offered if the animal is able to consume them, but if severely debilitated, waiting until after surgery is recommended. Oral fluids can be administered for mildly injured animals, while intravenous fluid therapy can be employed for cases of severe dehydration. The most common form of dehydration in wildlife trauma cases is isotonic dehydration. Therefore, a 0.9% saline solution which is heated to match the patient's body temperature is recommended, as this is considered a balanced fluid. If intravenous fluid therapy is employed, then a collar is necessary to stop the fox chewing, which they are prone to. Post-operative care is crucial for the success of any orthopedical surgical repair involving wild animals. A fox needs a stress-free environment, stable temperatures, not to be close to prey animals, and to be enclosed in a safe space. Analgesics should be administered before, during, and after surgery to ensure the patient remains as pain-free as possible through the procedure, with non-steroidal anti-inflammatory drugs and opioid analgesics most commonly used. In the immediate post-operative period, it can be beneficial to combine non-steroidal anti-inflammatory drugs and opioids to not only increase analgesic effects but to also improve respiratory function, reduce nausea, and reduce sedation. Wound management in wildlife trauma cases is of utmost importance, as infection can be potentially fatal to an already weakened animal. Establishing a healthy vascular wound bed that is devoid of foreign particles, necrotic tissue, and infection is needed before any surgery can be undertaken, The wound can be irrigated with a 0.9% saline solution, dilated chlorhexidine or povidone solutions, topped with a dry gauze and secured with a veterinary wrap. Can be used to secure the treated wound. Antibiotic creams should be used in between dressing changes, which should occur once a day and only used for 4 or 5 days, or tissue desiccation will start to manifest. Limbs can be splintered for foxes experiencing fractures using typical procedures outlined for domestic mammals, such as the Robert Jones bandages. When splintering a limb, the joint above and below the fracture should be stabilised, and the bandage and splint should be checked for problems. Keeping a bandage or splint on a wild animal may prove difficult, however, as they are not used to any foreign objects being in close proximity to their body and may try to remove them. Typical dog cones can be administered to the patients to reduce chances the animals will bite any bandages or casts. Vigilance is necessary when providing post-operative care to any wild animal, as they can become unpredictable and stressed. In conclusion, vigilance is always recommended when handling, triaging, or caring for a wild animal such as a fox. The unpredictability of wild animals means that veterinary staff must always be aware that all the times possibility of the attack and outbursts. Ultimately, the chances of the fox being reintroduced into its natural habitat is the main concern of any veterinary treatment. If a successful reintroduction is not possible, then euthanasia is advised. The need for further study on vulpine-specific veterinary needs is apparent in the literature available and signals a call for reform in the way wildlife is viewed by veterinary professionals.